I focus on cardiac imaging and cardiac imaging applied to epidemiology, that is public health, in terms of looking for what are the best ways to prevent heart disease and using imaging in lieu of the well-developed disease. What we are very interested right now is on this whole controversy about blood pressure and about what should be the level that blood pressure should be maintained. A few years ago, there were groups of physicians that felt that we were keeping the blood pressure or we were recommending to patients to keep their blood pressures a little too low, and therefore the guidelines have relaxed the indications or the recommendations for blood pressure control. Instead of 140/90 to 150/90, so back to the way it used to be. Well, several of us, and these first were established in Europe, and then the guidelines here also changed in that direction 1 or 2 years later. But several of us who have been working on this field feel that there should be different blood pressure thresholds depending on aging. And that 150/90 is too high of a blood pressure, particularly for somebody who is younger. So we've been engaged in this study called the CARDIA study, which is a study that recruited 18 to 30 years, recruited about 5,000 people, men and women, blacks and whites, of age 18 to 30, back in 1985. So we followed these individuals for 30 years now. We are doing the 30-year exam. And in year 25, we applied ultrasound to look at the strength of the heart. And we've noticed that people who had low blood pressure for these, at that time, was 25 years, had a stronger heart than people who had actually blood pressures in the higher. And again, these were mostly in the normal range, but they were in the high portion of the normal range. So what that suggested to us is that for younger individuals, we should perhaps keep the blood pressure at a lower level. And that report was published in the Journal of the American College of Cardiology a couple months ago, and it has had quite an impact because it comes from a cohort with such a long period of follow-up. More recently, we understand that the SPRINT study was stopped because those that were assigned to a lower blood pressure control had a better outcome than those who were assigned to a higher blood pressure control. So that supports the findings from the CARDIA study that we reported in the Journal of the American College of Cardiology. Of course, the official guidelines now is that the blood pressure should be kept below 150/90. Those are the guidelines at this point. And we think that's particularly important for the elderly, but we think that for younger individuals, blood pressure should be kept much lower than that, and probably 130 or 120/80 it would be the threshold that we would recommend.